వెల్కమ్ టు మహాలక్ష్మి థాట్స్. MLHP's ఎంట్రన్స్ ఎగ్జామ్స్ కోసం ఇంపార్టెంట్ ప్రీవియస్ ఎగ్జామ్ బిట్స్. ఫస్ట్ వన్ is నేషనల్ వెక్టర్ బోర్న్ డిసీజ్ కంట్రోల్ ప్రోగ్రామ్ aims at prevention and control of all except option 1 malaria and dengue, option 2 Japanese encephalitis and chikungunya, option 4 is lymphatic filariasis and kala-azar, option 4 swine flu and tetanus. Option 4 is the correct answer, swine flu and tetanus. Then coming to second one, the best method of disposal of hospital waste is option 1 incineration, dumping, burning and composting. Option 1 is the correct answer. Incineration is the best method to dispose of hospital waste. Next, third one. To avoid constipation, the diet of pregnant women should be rich in option 1 chapatis, option 2 egg, rice, option 4 is the salads and fruits. Salads and fruits to avoid the constipation, the diet of the pregnant woman should be rich. Option 4 is the correct answer. Next, a woman had her first TT dose at 4th month. She now come back for checkup at 8 months. What will you decide on giving TT injection? Option 1, give her the TT injection of double strength. Option 2, give her 2 more doses at the gap of 15 days. Option 3, don't give her TT injection. Option 4, give her the second dose of the TT injection. Fourth option is the correct answer. Next one, the time interval between the entrance of disease agent into the body and the appearance of first sign and symptoms of disease is incubation period, transmission, epidemic, infection. Option 1 is the correct answer, incubation period. Next one, after the first 3 months of pregnancy, the chief source of estrogen and progesterone is the option 1 placenta, option 2 corpus luteum, option 3 anterior pituitary gland, option 4 adrenal cortex. Option 1 is the correct answer, placenta is the chief source of estrogen and progesterone. Next, fetal heart rate should be checked for 5 seconds, 60 seconds, 30 seconds, 10 seconds, 60 seconds. Second one is the correct answer. Dental caries is caused due to deficiency of option 1 copper, option 2 fluorine, option 3 iron, option 4 iodine. Option 2 is the correct answer. What is the name of the vaccine against cervical cancer? Option 1 HPV vaccine, option 2 hepatitis, option 3 antiviral vaccine, option 4 IPV vaccine. Option 1 is the correct answer, HPV vaccine against the cervical cancer. The most frequent cause of maternal death during the childbirth is option 1 hemorrhage, option 2 toxemia, option 3 sepsis, option 4 asphyxia. Option 1 is the correct answer, hemorrhage. Which of the following is not an endocrine gland? Option 1 cervical gland, option 2 pineal gland, option 3 thymus, option 4 is parathyroid. Option 1 is the correct answer, salivary gland. No, salivary gland is not an endocrinal gland. Next, painful and profoundly swollen limb are a long-term physical consequences of option 1 lymphatic filariasis, option 2 yellow fever, option 3 malaria, option 4 dengue. Lymphatic filariasis is a painful and profoundly swollen limb. Pregnant women should be tested for which infection? Option 1 HIV, hepatitis C and syphilis. Option 2, HIV, hepatitis B and syphilis. Option 3, HIV, hepatitis A and syphilis. Option 4, HIV, hepatitis C and syphilis. Option 2 is the correct answer, HIV, hepatitis B and syphilis. What is the depth of chest compressions for an adult? Option 1, 4 to 6 centimeters. Option 2, 7 to 8 centimeters. Option 3, 3 to 4 centimeters. Option 4, 2 to 3 centimeters. Option 1 is the correct answer, 4 to 6 centimeters. Goiter is caused due to deficiency of fluorine, iron, copper, iodine. Iodine deficiency is the cause of the goiter. Sex ratio is option 1, number of females per 100 males, number of females per 1000 males, number of females and males, and fourth option is difference in the number of males and females. The sex ratio is number of females per 1000 males. Second answer is the correct. Information given by the patient about his illness, which is not visible, are called diagnosis. Second option, symptoms. Third option, prognosis. Fourth option is signs. Symptoms are not visible. Okay. Heimlich maneuver is called option 1, to improve the circulation, to stimulate the cardiovascular system. Option 3, to expel foreign body in the respiratory tract. Option 4, to improve the lung capacity. Heimlich maneuver to expel the foreign bodies in the respiratory tract. Option 3 is the correct answer. World Breastfeeding Week is celebrated. Option 1, August 1st week. Option 2, May 1st week. Option 3, August 2nd week. Option 4, May 2nd week. Option 1 is the correct answer. August 1st week we celebrate the World Breastfeeding Week. Rabies is the fatal viral disease of option 1, skeletal system. Option 2, cardiovascular system. Option 3, central nervous system and muscular system. Option 3 is the correct answer, central nervous system. Rabies is a fatal viral disease of central nervous system. Commonest obstetrics operation performed: perineal tear, episiotomy, perineography, vulval tear. The commonest obstetrical operation performed, episiotomy. Option 2 is the correct answer. Visible peristalsis may be seen in congenital megacolon, pyloric stenosis, peritonitis, constipation. Visible peristalsis may be seen in pyloric stenosis. Option 2 is the correct answer. Which of the following is the first step in processing of used instruments? Sterilization, cleaning, storage, decontamination. Decontamination is the first step in processing of using instruments. Break in the bone without break in the skin is called complete fracture. Our second option is open fracture. Our third option is incomplete fracture. Option 4 is closed fracture. Closed fracture. Answer is the fourth option. Breaking in the bone without breaking the skin is called as closed fracture. The nurse is asking a 6 months old child for developmental skills. Which of the following are normal and should be expected? Option 1, pulling up to a standing position. Option 2, sits alone. Option 3 is can feed self with a spoon. Option 4, speaks in short sentence. Option 2 is the correct answer. Sits alone. If you like this video, please like and share and subscribe my channel. Thank you for watching my video.